So what's next? It's a question we plan to answer regularly on a variety of topics, but tonight it means what's going to happen next with Obamacare. For more than a year, Donald Trump has vowed to repeal and to replace that unpopular law. Now he says he may keep some elements of it in place. Either way, though, President Obama's signature law isn't working as promised, and virtually everyone agrees on that. The question is why, and what does it mean? Joining us now is Obamacare architect Dr. Ezekiel Emanuel. Dr. Emanuel, thanks a lot for joining us. I appreciate it. It
nice
seems to me
that
Obamacare is the biggest piece of social reorganization passed in my lifetime, and yet it has never, so far as I know, had majority support, or never a strong majority support from beginning until now. Starting just at the very beginning, shouldn't you get, I've never seen a poll that suggests the majority of Americans support Obamacare, so shouldn't you get buy-in from the public before reorganizing their health care?
The public likes many of the provisions. You poll, keeping your child on your parent's plan till age 26, almost 80% of the public likes that.
Yeah,
no pre-existing disease exclusions, almost 75% of the public likes that. Closing the donut hole for Medicare beneficiaries, 75% of the people like that.
You're right about it. I'm very aware of that. But
the only provision.
Shouldn't you get people to buy in first?
Wait, did you ask me a question? I'm answering the question.
Yes.
Okay, so let me answer the question, please. A little respect.
Go ahead.
The only provision that scores under 50% is the mandate, and people haven't understood that if you want no pre-existing disease condition exclusion, you have to have a mandate. Those are inextricably linked. So the public, of course, would like their cake and eat it too, but you cannot have both of those.
Before you continue to patronize the public, let me just make one thing really clear. So the poorest segment of our society is young people. In fact, this generation is the poorest generation of its age in 3 generations. They're the poorest. And yet we're forcing them to buy into the system to subsidize the health care of the old and the sick, or also the richest segment of our population. Why is that fair, and why would you expect them to like it?
Well, first of all, young kids are subsidized in the Obamacare plan. If they don't make above 100% of poverty, they go on Medicaid, and they get almost cost-free health care. And if they are on the low end of income, they are very heavily subsidized to get health insurance. They're not spending a lot of money for peace of mind and protection. And I think that is a good deal. One of the reasons I'm so passionate...
They don't think it's a good deal,
Tucker, are you going to let me finish the mic?
Well,
one of the reasons I'm so passionate about health care reform...
They don't think it's a good deal. That's why you're trying to force them to do it, right? Am I missing something? I just trying to get a straight answer from you. You're trying to force them to do something they don't want to do. You're telling them it's a good deal, but they don't believe it's a good deal. Why don't they believe that?
Yeah, and a lot of them haven't explored what the deal is. They've heard your rhetoric that it's not a good deal, and they haven't actually seen. Most of them, if they're not earning a lot of money...
So you're saying that I've convinced people that Obamacare isn't as great as it really is? Is that what you're saying?
Oh, there's certainly been a lot of very bad rhetoric and very bad attacks on it, rather than give it its fair shake.
Are you going to blame right-wing talk radio?
I do think we can actually make the deal better. I've made proposals out there how to adjust it. You know, if you were a business and you launched a major initiative, you would revise it as unintended consequences occur, as you see that there are problems. The problem here is Congress hasn't allowed us to make those mid-course adjustments for 6 years. And that's a serious problem with the workings of the machine.
I get it.
Are you going to let me finish an answer, or you keep interrupting me like I'm not your guest? Treat me like your guest.
I've let you finish. Let me just say this, though, to add to what you said. The President began this with a joint speech to a joint session of Congress in 2009 in which he said Obamacare will be the end of the discussion of how to organize health care in this country. I was sitting right there, and he said that. He promised us that it would be perfect upon arrival. Shouldn't someone at least acknowledge that that wasn't true before we move on to the next iteration of Obamacare? Are we just going to keep lying and hope nobody notices?
That is totally untrue statement. The President never thought it was going to be perfect upon arrival.
Do you want me to read you the quote?
We live in a democracy. No legislation is perfect. All of us who worked on it knew that when it was finished, there were issues we would have to address down the line, that we would learn about problems, and we'd have to fix them. Congress just was, the Republicans were totally intransigent about fixing problems as they arose.
We all watched this happen, and I'm sorry, you would have much more credibility if you would just say, you know, we were kind of wrong about some things. You can't keep your doctor. It's more expensive than we thought it was going to be. Healthy people have to subsidize it. Instead,
Actually,
you blame
it's
the
not
right
more
wing,
expensive
and
than we
Republicans
thought.
in Congress
Could you
would have
show
passed on a party line
please
vote.
show my
This is
slide,
sad, and I
Tucker?
would expect more from someone
Tucker,
who's an eminent doctor,
show
honestly.
my slide. Tucker,
Show your slide.
the slide
All right.
I gave you to put up here.
Okay.
Are you showing the
I'm
slide?
sorry,
with
there's
the
your slide right there. But it doesn't,
Okay.
it doesn't mask your demagoguery, doctor. And you just blame the Republicans who had not one thing to do with this legislation, as you know, and you discredit yourself by doing that. And I'm trying to
They
take
had
you
a lot to
seriously,
do with it
but
by
you're
their
making it
negative
hard.
non-helpfulness.
Okay, their
On that
non-helpfulness.
graph,
I'm sorry.
it shows you
Right.
what healthcare inflation has been, and the fact that healthcare inflation has come way down because of,
Okay.
partially because of Obamacare. And that difference between the two curves is $4,000 for a family. That's important savings that are the president made possible. In fact,
it's the same
he
story.
did
It's a great
keep
deal.
that
You're just
pledge.
too dumb to get how great it is. I've heard this before. Thanks a lot, doctor. I appreciate your coming on. Thanks.